The grave of Amelia Huddleston's 3-year-old is full of her Ngukurr community's tributes. She's devastated by his death in March.
He was smart, beautiful, kind, loving little boy.
In the week her son died, she took him to the local clinic run by the Sunrise Health Service Aboriginal Corporation 3 times over 4 days, suffering fever and coughing. He was given Panadol and an antibiotic, but by the 4th evening he was struggling to breathe.
He kept saying, "Help me, help. Mommy, Daddy, help me."
When Amelia called the clinic at 8:30 p.m, a senior nurse said he was unable to help because he was treating another patient.
They kept saying, "Bring him in the morning, we have an emergency."
When she brought him in the morning, he was hyperventilating. The 2 senior nurses weren't on duty at the clinic, so a junior nurse took instruction by phone from doctors for 3 hours, until the boy's heart stopped. A post-mortem report presented to his family by Sunrise found the cause of death was a Staphylococcal aureus infection, on which the penicillin antibiotic didn't work.
The doctor told us that he had a chance of living if he would have get the right medication. He could have survived if they would have flown us out that night when we rang or in the morning.
The Ngukurr community wrote to the NT government detailing a series of incidents, complaining about staff shortages and asking it to take the clinic over, and to the federal government, which funds Indigenous health services, to support that. Both have declined.
Really, it's not good enough. The response came back to us.
We're not saying we won't listen to them, but there are structures in place.
4 former Sunrise Health nurses have told the ABC Ngukurr and some of Sunrise Health's 7 other clinics are regularly undermanned with inexperienced staff, and there are insufficient visits by doctors.
We had doctors coming in for 2 days a week. The continuity of care was a huge issue.
They've alleged orders of vital patient medication were regularly delayed. Sunrise Health said it's common for remote medical services to share doctors, and doctors are available to its clinics 24/7 by phone. It rejects the nurses' allegations of inadequate medication provision. The nurses who work across the NT, Queensland and WA say understaffing, inexperience and insufficient cultural training plague both Indigenous and government health services in many remote areas, and they want minimum standards on these mandated.
I believe we are at the point of requiring a Royal Commission into preventable deaths in remote Aboriginal communities.
The government ought to do an investigation, really a thorough investigation.
The federal government responded that it's working with the First Nations health sector to close the gap. Jane Barton, ABC News.